Hello, folks, and welcome to week 3, chapter 3 of phlebotomy. Today's topic is going to include infection control, safety, first aid, and personal wellness. Some of the objectives of this week's lesson are to 1. Demonstrate knowledge of terminology, precautions, procedures, practices, and programs related to infection control, and identify associated agencies. Number 2, to identify key elements of the Occupational Safety and Health Administration, or OSHA, Bloodborne Pathogen Standards and Needle Stick Safety and Prevention Act, and identify their associated agencies. And 3, identify general laboratory safety rules and safety rules that apply while in the patient rooms and other patient areas. Number 4, you want to identify hazards, warning symbols, safety rules, and associated biological, chemical, electrical, fire, and radiation safety, and discuss action to take if hazardous incidents do occur. Number 5, recognize symptoms requiring first aid and list the main points of the American Heart Association CPR and emergency care guidelines. Although we will not be formally trained in CPR in this course, you should have an idea of the concepts and have a little bit of a motivation to take maybe a CPR and first aid class on your own. And 6, describe the role of personal wellness as it relates to nutrition, rest, exercise, stress management, and back protection. So to start off by talking about infection control. Infection is, like it says there, a condition that results when a microorganism, or microbe for short, is able to invade the body, multiply, and cause injury or disease, either by directly affecting an organ system or by causing toxins that affect the organ system themselves. Sometimes an infection itself doesn't necessarily cause damage. However, the inflammatory and immune response that occurs secondary to that infection causes more disease than the infection itself. So examples of some microbes would be bacteria, fungi, protozoa, and viruses. Bacteria are single-celled organisms that by themselves can either live with or without a host. There are many more bacteria in the world that are benign and harmless, and even some that are beneficial, than are those that actually cause disease. Only very few bacteria actually do cause disease. Fungi or funguses are unicellular organisms that grow into all sorts of separate environments, and again, some are disease causing and some are actually beneficial. Protozoa are, again, single cell parasitic organisms that have both plant and animal like properties. They tend to act more like animals than they do like plants. And then there are viruses, which are protein encapsulated organisms that cannot live on their own. They need some type of host or some type of cell to latch onto, inject their genetic material into, and then move on. So when we talk about any of these agents that can cause disease, we refer to them as pathogens. A pathogen is a microbe capable of causing disease. So most of the infections we talk about are communicable. Now, communicable disease does not necessarily have to lead to illness, but it's a disease that's able to spread from person to person, as opposed to an infection that's autologous, or what we mean is refers from the body's own self. For example, when somebody's appendix bursts, they don't transmit that infection to another person. That infection goes from one part of the body to another part of the body and causes systemic illness. The CDC, or Center for Disease Control, investigates and controls communicable diseases and epidemics. The World Health Organization investigates pandemics, or worldwide infections. A nosocomial healthcare associated infection is usually referred to as a hospital-acquired infection, and it's a big problem in healthcare these days. As it says here, 1 in 25 hospitalized patients in the United States has one hospital-acquired infection, and more than 1 million occur each year, not only costing billions of dollars, but these infections are very difficult to treat. They're usually very resistant to standard treatments. Hospitals have to take multiple steps to limit these infections, because once it's determined that an infection has been hospital acquired, that ultimately translates into a failure of that healthcare agency to adequately protect that patient against an infection, in which case insurance reimbursements are canceled, lawsuits can be contemplated, and these are usually caused by infected personnel, mostly healthcare personnel, other patients, visitors, contaminated food, drugs, or equipment that hasn't been properly decontaminated and sterilized. So in this day and age, treating antibiotic-associated illnesses is difficult because there is a high prevalence of antibiotic resistance. Back in the 1940s, almost all forms of pneumonia were susceptible to basic penicillin. Now, most forms of pneumonia are completely resistant to penicillin, as well as many other severe infections. So some of the well-established antibiotic-resistant bacteria that you should be somewhat familiar with is Clostridium difficile, or C. diff. C. diff is a bacteria that can reside in the large bowel and usually doesn't cause a problem in itself until good bacteria in the colon is wiped out from excessive or inappropriate antibiotic use, and then can it cause a very severe form of colitis, which can land a patient in the hospital, can even have them wind up having some of their colon surgically removed. This is why it's really imperative for healthcare providers to be conservative and judgmental in prescribing antibiotics. Antibiotics not only kill bad bacteria, but they kill good bacteria as well. And when good bacteria is wiped out, that gives a chance for the bad bacteria, like C. diff, to take over. Other forms of antibiotic-resistant infections are MRSA, which causes skin infections and abscesses, Enterococcus, which can cause severe stomach issues. Some other multi-drug resistant gram-negative bacteria. I mean, don't focus too much on gram-positive, gram-negative unless you already took a microbiology class. Carbapenem resistant Enterobacteriaceae, CRE. Actinobacter, and Pseudomonas. Pseudomonas is a very, very difficult infection to treat. Usually requires multiple antibiotics and usually IV antibiotics. So a patient with a pseudomonal infection will most likely have to be hospitalized. So when you talk about the steps that occur when an infection occurs, we talk about a chain of infection. Well, first off, there is this infective agent, this pathogen, which is a microbe that's responsible for causing an infection. Now, again, we said not every microbe is capable of causing infection. There are many more beneficial microbes than there are harmful. Or sometimes a microbe that's beneficial in one area of the body can be harmful to another part of the body. The bacteria that's sitting around in your large intestine under normal circumstances is very beneficial. It helps prevent bad bacteria from entering. It has roles in producing vitamin K. However, when that bacteria is introduced into another part of the body from a ruptured appendix or a ruptured colon and gets into the abdominal lining, that can cause systemic illness. Then you have a reservoir, which is a source of that infectious agent, a place where the microbe can survive, grow, and multiply. Could be a human reservoir, animal, food, contaminated water, soil, or even equipment, especially catheters. It needs some exit pathway, a way for that agent is able to leave the reservoir or host, either through a sneeze, a cough, bleeding, or any type of body fluid exposure. Then continuing that chain of infection, you have to have some means of transmission. You can have airborne transmission, which we've seen quite frequently with COVID and other illnesses, and other transmissions by either direct or indirect contact. Direct contact involves direct touching of the source individual to the exposed individual, touching, kissing, hugging, or indirect contact, which is probably one of the most common ways of picking up a common cold. Somebody has a common cold or a flu or some type of infectious respiratory disease. They sneeze on their hand, they open a doorknob, second person opens the same doorknob, inadvertently wipes their nose, touches their eye, and then introduces that agent into their own system without having been anywhere near that source patient. Droplets are usually spread through coughing, sneezing, through large particles. as opposed to aerosolized exposure, where the particles are much more finer and stay in the air much longer. A vector is an insect that usually transmits disease from one individual to another. An example would be Lyme disease, which is carried through the deer tick. It usually results in picking up the bacteria that causes Lyme disease from a deer in the woods. Somebody gets it on themselves, the tick injects its, I don't know, its bloodsuckers into the bloodstream. While it's trying to drink blood from the host, it's injecting that bacteria into the host and then winds up causing the condition of Lyme disease. And in other vehicles, through food, water, drugs, contaminated food, foodborne illnesses, contaminated water, which over the course of history has been a huge killer of great populations and still is in third world and developing countries, and so on. Then there has to be an entry pathway, a way for that infectious agent to enter a susceptible host. And part of this lesson was to learn about how to minimize all entry pathways from yourself by taking proper standard precautions, hand hygiene, and other modes of barrier protection. And then the host themselves has to be susceptible. Someone with a decreased ability to resist infection could be more likely to become ill from benign illnesses that wouldn't affect other individuals. A very common, well-known condition is acquired immune deficiency syndrome. Patients who have acquired HIV infection and subsequent condition of AIDS tend to be susceptible to many infections that, I don't want to say normal people, but individuals with healthy immune systems can usually fight off without even knowing that they're sick. And so here's just a diagram of that whole concept that we were talking about, the infection control, starting with the infectious agent, the reservoir, exit, means of transmission, entry pathway, and then susceptible host. These are important points to know. So what can we do to break the chain of infection, to prevent the transmission of pathogens from a host to a reservoir to a susceptible individual? Well, one of the most important concepts is hand hygiene. Hand washing is probably the most important preventative measure to stop the chain of infection. Nutrition, rest, and stress reduction are all play a key part in maintaining a healthy and optimum immune system. Proper immunizations, and whether your political values agree or disagree with it, the whole immunization campaign over the last couple of 100 years has significantly reduced illness worldwide and has been probably one of the most major public health success stories in the history of our population. Proper decontamination of services and instruments, disposals of sharps and infectious waste, paying meticulous attention to needles and other sharp instruments. Use of proper personal protective equipment, including gloves, gowns, masks, and respirators if needed. Needle safety devices. These days, medical technology companies are always looking for a safer way, a safer means of producing a needle product that reduces the risk of exposure to healthcare personnel. Infection control programs, protocols put forth by the healthcare agency to reduce spread of infections. Insect and rodent control, the great plague of Middle Europe back in the early ages was all due to widespread process from rat infestation. And then proper isolation procedures for patients who have severe infectious transmittable diseases. So a good infection control program that's put forth by your healthcare agency is designed to protect patients, employees, visitors, and others, vendors and so forth, to break the chain of infection through any one of those steps that we talked about. Monitor and collect data on all infections occurring in the institution, especially hospital-acquired infections, because those are situations that this hospital tends to take very seriously. Institute special precautions in the event of outbreaks. So as of the date of the publishing of this video, we've already been through the COVID epidemic for about 2.5 years, and now monkeypox is something to worry about. Maybe 10 years back, we had to worry about the outbreak of the introduction of Ebola into this country. It's always going to be something at some point in time that medical institutions have to be ready for. And some of these components include employee screening, health screening questionnaires, offering proper immunization, evaluation and treatment of certain hospital-acquired or incidental exposures, and then surveillance, keeping statistics and data over infections that have occurred over time. As I mentioned before, probably the most fundamental and successful and important step in preventing disease transmission is proper hand washing. Alcohol-based hand sanitizers are good in a pinch. However, they do not grossly decontaminate dirty hands. So if you get exposed to blood and feces or any other type of bodily fluids, hand gel's not going to cut it. Hand sanitizers do not also kill every pathogen. Things like anthrax, C. diff are very, very difficult to kill and require extensive hand washing. Not that those are very common exposures, but just something for you to keep in mind. Most of these alcohol-based hand sanitizers, just as we said, they're alcohol-based. Alcohol tends to evaporate very, very quickly. Other forms of protective equipment include gloves, especially when you're dealing with any type of bodily fluid, because you could have little subtle nicks and cuts on your hands that you don't even know about. Gowns to prevent soilage of your uniform or your work clothes. Lab coats if appropriate. In this day and age, face masks are almost basically mandatory, with face shields and goggles if there's any possibility of airborne or droplet transmission. And of course, well-fitted respirators that are like an N95 NIOSH or HEPA filter respirator that really filters out even the smallest of pathogens like tuberculosis and coronavirus today. We'll go over in class a proper procedure and video as far as proper glove removal. It's important to remove your gloves in a proper way to prevent something called cross-contamination. Getting your hands contaminated while removing dirty gloves. Look over that in your textbook. Respirators are pretty much mandatory these days. As you can see here, this individual is wearing a proper N95 respirator that has the metal clip on the end that is well fitted. It has to be properly tested. So many healthcare institutions will have you go through an orientation and a screening, and they will give you a proper what's called fit testing appointment, where they evaluate to see if you can actually detect the smell or taste of saccharin through this device. It has to be properly measured, it has to be properly worn, and it has to be the right size for the best effectiveness. So in order to avoid the possibility of cross-contamination of infectious agents, it's important to don and doff or put on or take off your personal protective equipment in the proper order. So when donning a complete set of PPE, such as a gown, mask, and gloves, the gown is put on first. The mask or respirator, if indicated, is put on next, making certain it covers the mouth and nose. If goggles or a face shield are required, they're put on after the mask or respirator. And then the gloves are put on last and pulled over the cuffs of the gown. Protective items must be removed in an aseptic or sterile-free manner to prevent contamination of the wearer and promptly discarded. So in that order, the gloves are removed first, being careful not to touch the contaminated surfaces with ungloved hands. Goggles, face shields can be removed next, touching only the headband or earpieces. The gown is then removed by pulling it from the shoulders towards the hand so that it turns inside out. It must be held away from the body and rolled into a bundle before discarding. Then the mask is removed last, touching only the strings, and then immediately decontaminate the hands right after PPE removal. So The term asepsis or aseptic technique is a condition of being free of contamination or germs that could cause disease. Something that is free of disease-causing microbes is said to be aseptic. Aseptic technique is a healthcare practice used to reduce the chance of microbial contamination with the goal of protecting patients from infection and preventing the spread of infection. And that includes things as proper hand hygiene, prevent dropping supplies, opening packages to avoid contamination properly, prompt and safe disposal of contaminated equipment, prompt cleanup of infectious material, and wearing gloves for blood collection and other personal protective equipment. NICU or neonatal ICU, neonatal intensive care unit infection control technique includes washing hands and putting on clean gloves, gathering only those items necessary to perform a specimen collection, leave the blood collection tray or cart outside the nursery, and removing your gloves, decontaminate hands, and put on new gloves in between patients. Now, one of the ways in which infection control programs minimize the spread of infection is through the establishment of isolation procedures. Isolation procedures separate patients with certain transmissible infections, such as COVID or maybe Ebola, from contact with other patients and limit their contact with hospital personnel and visitors. Isolating a patient requires a doctor's order and is implemented either to prevent the spread of infection from a patient who has a suspected or having a contagious disease, or to protect a patient whose immune system is compromised, such as someone who's been involved in a burn unit or somebody who's on immune reducing drugs. Patients are most commonly isolated in a private room. A card or a sign indicating the type of isolation along with description of required precautions is typically posted on the patient's door. A cart containing supplies needed to enter the room or care for the patient is typically placed outside the hall door as well. So as far as isolation procedures, it's important to wear the protective and reverse isolation for patients who are highly susceptible to infection. Could be someone who's receiving chemotherapy, could be somebody who's on a burn unit, could be somebody who has uh, just recovered from an organ transplant. Using all the universal precautions that we have just spoken for, protecting against blood and body fluids, all people are potentially infectious. Gown up, substance isolation, goes beyond universal precautions. Gloves for contacting moist bodies. So standard precautions must be used in the care of all patients and constitute the number one strategy for prevention of hospital-acquired infections. This blanket approach is necessary because a large percentage of individuals with infectious diseases do not have symptoms and may not even know that they have the disease. Standard precautions combine major features of universal precautions and body substance isolation to minimize the risk of infection transmission from both recognized and unrecognized sources. These precautions apply to blood, all body fluids, non-intact skin, mucous membranes, and standard precautions include hand hygiene procedures, and depending on the type of exposure to body fluids anticipated, the use of PPE such as gloves, gowns, and masks as well. Transmission-based precautions are used to treat for patients known or suspected to be infected or colonized with highly transmissible or epidemiologically significant pathogens that require special precautions in addition to standard precautions. Three types: airborne, droplet, and contact. The term biosafety is a term used to describe the application of safety precautions taken to ensure the safe handling of biological substances that may pose a risk to health. Hazardous biological substances can be encountered daily in a healthcare setting, so healthcare personnel must be able to recognize them and take the precautions necessary to eliminate or minimize exposure to them. So any substance that involves the possibility of a biohazard has this symbol that you see on your slide right here. And as mentioned before, biohazard exposure routes could be by airborne means, through sneezing, coughing, ingestion, through contaminated food, non-intact skin, from indirect contact, percutaneous, very commonly through accidental needle sticks, or through paramucosal means, through the mucous membranes. Droplets touching the eyes, the mouth, the nose, and then introducing into the system that way. One of the more serious risk factors to healthcare personnel, especially those of phlebotomists who are going to be working with blood and potential exposure to blood, is that of hepatitis B and to a lesser degree hepatitis D. Hepatitis B is a viral infection that predominantly affects the liver and is life-threatening. It can cause serious acute illness and long-term chronic illness as well. It's one of the leading causes of full-blown liver failure. And one of your best defenses against hepatitis B is to receive the series of hepatitis B vaccinations. It's a combination of 3 vaccinations which occur on day 1, 30 days later, and then 6 months later. And it can confer close to about a, don't quote me on this, but about a 90%, over 90% protection level. The hepatitis B virus is present in blood and other body fluids. Unlike HIV that dies outside the body very quickly, the hepatitis B virus can survive outside of the body for weeks. It can live in dried blood. It's very commonly found and transmitted via dirty needle sticks and for sexual contact as well. And symptoms include, just like any viral illness, flu-like syndromes, fatigue, loss of appetite, mild fever, joint aches, abdominal pain, nausea, vomiting, and quite often a yellowish hue to the skin that we call jaundice. Hepatitis C is also somewhat common, although less so than hepatitis B. And the exposure hazards are pretty much the same as hepatitis B. It's very common in intravenous drug abusers. It's present in blood and serum, so it is considered a sexually transmitted disease as well. Infection usually occurs with hepatitis C after large or multiple exposures through either needle sticks or sexual contact. Unlike hepatitis B, however, there are no vaccinations as of yet to the onset of hepatitis C, and there is no known cure. Symptoms are very similar: flu-like symptoms, fatigue, loss of appetite, mild fever, muscle, joint, abdominal pain, nausea, and vomiting. Now, we're all pretty much familiar with HIV and AIDS. Some of us may still not know the difference between the terms HIV and AIDS. HIV, human immunodeficiency virus, is the virus that is responsible for the acquisition of the condition called AIDS, acquired immune deficiency syndrome. AIDS is a condition where your body is unable to fight off very common, what we call opportunistic infections that a normal immune system would have no problem fighting off. The virus itself makes it possible for the immune system to just completely crash, allowing these infections to occur. HIV, the virus itself, is present in blood, semen, saliva, tears, urine, cerebrospinal fluid, amniotic fluid, breast milk, and cervical secretions, as well as tissue. Although very few of these means actually result in transmission. Risk to healthcare workers is primarily through exposure to blood. There is no, as of yet, vaccine for HIV. There is no cure for HIV. Symptoms, a lot of times people with symptoms of HIV infection are completely asymptomatic. They don't have any illness. So that's why you cannot recognize a person who has HIV infection just based on their physical appearance. So we have to, in our practice, assume that every single patient that we come into contact with has the potential for HIV as well as other blood-borne illnesses. Symptoms progress through a mild, severe flu-like symptom, then a period of calm, of getting over, then other diseases such as hairy leukoplakia, which is a white-coated tongue, Kaposi sarcoma, which are cancerous lesions of the skin, neurologic symptoms, and dementia, just to name a few. This is when a person has progressed to full-blown AIDS. So the OSHA standards for bloodborne pathogens was born out of the situations that occurred in the 80s and the 90s through a lot of myths and misconceptions and misinformation about AIDS and HIV. OSHA stands for Occupational Safety and Health Administration. The OSHA BBP standard was promulgated or put into force when it was concluded that healthcare employees face a serious health risk from occupational exposure to blood and other body fluids and tissues. Enforcement of the standard, which is mandated by federal law and which OSHA is also responsible, is intended to reduce the chance of occupational exposure to bloodborne pathogens. The standard requires implementation of engineering controls, work practices to prevent exposure incidents, availability and use of PPE, special training, medical surveillance, and the availability of vaccination against hepatitis B for all at-risk employees, especially ones who are dealing with blood. Uh, Although exposure to BPPs is still a serious issue, the incidence of occupationally acquired Hep B infection has declined significantly since these regulations were put into place. Now, the Needle Stick Safety and Prevention Act imposed additional requirements on healthcare employers concerning sharps procedures in order to further reduce healthcare workers' exposure to bloodborne pathogens. The Act directed OSHA to revise its BBP, bloodborne pathogen standard, in the following four key areas. 1. The revision and updating of the exposure control plan. 2. Solicitation of employee input in selecting engineering and work practice controls. 3. Modification of definitions relating to engineering controls. And new record-keeping requirements, including the requirements to keep a sharps injury log. And to comply with the OSHA BBP standard, employers must have a written exposure control plan. The plan must be reviewed and updated at least annually to document the evaluation and implementation of safer medical devices. Non-managerial employees with risk of exposure must be involved in the identification, review, and selection of engineering and work practice controls, and their participation must be documented. So it's very important for you as employees of any healthcare institution to take a proactive part in these exposure plans for your own safety. Because occupational exposure to bloodborne pathogens can occur in any of the following happens while a healthcare worker is performing his or her duties. The skin is either pierced by a contaminated needle or sharp object. Blood or other body fluids splash into the eyes, nose, or mouth. Blood or other body fluids come into contact with a cut, scratch, or abrasion, or a human bite breaks the skin. Now, implementation of proper personal protective equipment and standard precautions can help minimize the exposure but cannot eliminate them completely. An exposure incident requires immediate attention for the most promising outcome. If the exposure involves a bloodborne pathogen, the immediate response by the employee in the event of an exposure incident includes the following. In the event of needle stick or other sharp injuries, carefully remove the shards of glass and other objects. Wash the site with soap and water for at least 30 seconds. For any blood or body fluid splash, affecting the mucous membranes, flush the site with water or sterile saline for at least 10 minutes. Use eye wash station if available to flush the splash to the eyes. Remove your contact lenses if you wear them and try to disinfect them as quickly as possible. It is very important to report this incident to your immediate supervisor. Do not let embarrassment or shame prevent you from getting the proper medical treatment, which can prevent long-term and serious illness on your part. So OSHA requires surface in specimen collection and processing areas to be decontaminated by cleaning them with a 1 part in 10 bleach solution or other disinfectant approved by the EPA, which is a government agency whose mission is to protect people's health and the environment by implementing and enforcing environmental laws. Special EPA-approved chemical solutions and kits are available for cleanup of blood and other body fluid spills and for disinfecting surfaces. gloves must be worn during the cleanup process. Cleanup procedures, which vary slightly depending upon the area and the type of spill, should concentrate on absorbing the material without spreading it over a wider surface area than the original spill. And then disposable cleanup materials must be discarded in a proper biohazard waste container. Non-reusable items contaminated with blood or body fluids are biohazardous waste and must be disposed of in proper special containers or bags marked with the biohazard symbol we saw previously. So phlebotomists may encounter hazardous chemicals when using cleaning reagents, adding preservatives to a 24-hour urine container, or delivering specimens to the laboratory. Inappropriate use of chemicals can have dangerous consequences. For example, mixing bleach with other cleaning compounds such as ammonia can release dangerous gases that could be toxic. In addition, many chemicals are potent acids such as hydrochloric acid used as a urine preservative or alkalis, both of which can cause severe burns. Container labels provide important information regarding the contents and should always be read carefully before use. So some general safety rules to observe when dealing with chemical agents are: 1, always wear personal protective equipment and always clean up chemical spills properly according to protocol. Never store chemicals above or at eye level, which have the potential to fall off the shelves and spill on you. If anybody's ever taken a chemistry class, never add water directly to acid. That can cause a volatile chemical reaction. Don't ever indiscriminately mix chemicals together without knowing what they are and what the reaction is. Never store chemicals in unlabeled containers, and don't let your employers allow you to do that as well. Never pour chemicals into dirty containers, and never use any chemicals in ways that they were not intended to be used. So OSHA has developed what's called the Hazard Communication or HAZCOM standard, HCS, to protect employees who may be exposed to hazardous chemicals. According to the standard, all chemicals must be evaluated for health hazards, and the chemicals found to be hazardous must be labeled as such and the information communicated to employees. The HCS has been revised to align it with the globally harmonized system of classification and labeling of chemicals that is being promoted worldwide. The intent of the revised HCS standard is to increase employee safety and by providing consistent, easily understandable information concerning the safe handling and use of hazardous chemicals. Important requirements include statement of warning or how much danger this poison may be encountered, statement of hazard, whether it's a toxic agent, flammable agent, combustible agent, precautions to eliminate the risk of contamination, and first aid measures for spills and other exposures. The safety data sheet, in addition to the labeling requirement, is usually posted in work offices and gives a certain amount of information for all chemicals that are used within the occupational, or in our case even the academic setting. So I'm sure everybody in this program has seen these signs at some point in time, either on trucks transporting potential hazardous materials on the highways, or in factory settings or industrial settings which use hazardous materials in their day-to-day operations. These are called the Department of Transportation labeling systems. So hazardous materials may also have a DOT placard. The DOT vehicle placards are diamond-shaped signs with GHS symbol identifying the hazard and hazard class number between 1 and 9. You don't have to memorize what all these symbols are, just be familiar with this. Vehicles carrying chemicals also need to have a 4-digit number designated by the United Nations or North America that identifies the chemical being transported or utilized. This number is either incorporated in the middle of the diamond or located next to it on the placard. The hazard class name, whether it's flammable or explosive, is sometimes substituted for the four-digit number on placards placed on the shipping boxes or containers. Another hazardous material labeling system is called the 704 marking system, which was developed by the National Fire Protection Association to label areas where hazmat materials and chemicals and other materials are stored, thus alerting firefighters and other rescue personnel in the event of a fire. This system uses a diamond-shaped symbol divided into four diamond-shaped quadrants. Health hazards are indicated in the blue diamond on the left. The level of the fire hazard is indicated in the red diamond. Stability or reactivity hazards are indicated in the yellow diamond on the right, and other specific hazards are indicated in the white diamond on the bottom. The colored diamonds contain a number that rates the degree of hazard from 0, which is no hazard, to 4, which is severe. And you can see here, this is just an example of the National Fire Protection Association 704 marking system, as some examples and explanations. So you might have seen these stations in some of the chemistry labs that you've taken on campus if you've taken any chemistry classes. The CLSI Clinical Laboratory Safety Guideline states that safety showers and eye wash stations should be within a 10-second walk, approximately 55 feet, from all locations in which hazardous chemicals or infectious materials are used. You should know the location of all safety showers and eye wash stations and know how to use them in the event of a chemical spill or splash to the eyes or other body parts. The affected body parts should be flushed with water for a minimum of 15 minutes, also followed by a mandatory visit to the emergency room for evaluation, preferably by 911 EMS. Chemical spills require cleanup using special kits like you see in the slide right here, containing absorbent and neutralizer materials. The type of materials used depends upon the type of chemical spilled. An indicator in the cleanup materials detects when the materials have been neutralized and are safe for disposal. This is all regulated by the EPA, the Environmental Protection. So at this point, we're going to talk about some safety and some wellness items. However, the topics we discuss are no substitute for taking a standard CPR and first aid class, which I encourage everybody in this program to do, especially if you're going into healthcare. So as far as talking about electrical safety, fire and electrical shocks are potential hazards associated with the use of electrical equipment. First and foremost, knowledge of the proper use, maintenance, and servicing of all electrical equipment that you use on the job, such as centrifuges, can minimize hazards associated with their use. In any event, if an electrical shock or an emergency occurs, first things first, shut off the source of the electricity before attending to anybody who may be injured or victimized. If the source of electricity cannot be shut off, use non-conducting materials like hand inside a glass beaker to remove the source from the electricity from the victim. Call for medical assistance 911 immediately. Start CPR if needed. We'll talk a little bit more about CPR when we get to the ends. All employees should know fire safety issues. They should know the procedures to follow in case of a fire, the location of fire extinguishers, and how to use them. That's generally an issue that would be addressed in your orientation wherever you're working. Location of fire blankets and heavy towels and how to use them. And most importantly, the exits, proper exits and evacuation routes in case of a fire. So just as a review, there are four components present at the same time which are necessary for a fire to occur. Three of these components are fuel, some type of combustible material, heat to raise the temperature of the material until it ignites or catches fire, and oxygen to maintain combustion or burning. Have traditionally been referred to as the fire triangle, but there's a fourth component. The chemical reaction that produces fire changes the triangle into what's called a tetrahedron, or a four-angled shape to describe how fires work. The best thing is to keep these components apart in order to prevent the fire. And as you can see, the four components, there's the heat, fuel, oxygen, and chemical reaction that can cause complications, medical complications, even after exposure to the fire. A Class A fire is an ordinary combustible material. Wood, paper requires simple water or water-based extinguisher to put out. Class B fires involve flammable liquids and vapors like paint, oil, grease, gasoline. These are things that you don't want to just pour water on to put out. It won't work. They require oxygen blocking agents or smothering agents to extinguish. Class C fires involve electrical equipment, electrical fires. These require special types of fire extinguishers as to not conduct the electricity and make the person trying to put the fire out a victim. Class D fires are combustible reactive metals like sodium, potassium, most likely magnesium, require dry powder agents or sand to extinguish. Class K, I don't know what happened to E or the other letters, but are high temperature cooking oils, greases, or fats, require agents that prevent them from splashing around and spreading the fire. Although, as phlebotomists, we don't deal directly with radiation, all labs and all healthcare facilities have radioactive equipment and materials that could be a source of exposure if some type of emergency were to occur. The principles involved in radiation exposure are distance, shielding, and time. This means that the amount of radiation you're exposed to depends on how far you are from the source of the radioactivity, what protection you have from it, whether it being full lead gear, and how long you are exposed to it. Exposure time is important because radiation effects are cumulative. The ability to recognize and react quickly and skillfully to an emergency situation may mean the difference between life and death for a victim, especially a coworker or a patient. First aid is something that can usually be carried out by a bystander or somebody with minimal or even no training, just a little bit of knowledge of what to do. As far as external bleeding or hemorrhage, your first and foremost treatment is usually direct pressure on the wound to stop bleeding, either using a cloth or a piece of gauze, preferably having universal precaution like gloves in place. But even if you don't want to apply direct pressure directly to someone who's injured, you can tell that person to apply direct pressure to their wound themselves as well. As far as first aid goes, any help at all is always usually better than no help at all. Shock, or something called hypoperfusion, involves insufficient return of blood to the heart, which results in inadequate supply of oxygen to the body's organs and tissues. This can be caused by bleeding, hemorrhage, heart attack, certain type of traumatic injuries, or drug reactions. It also can occur through severe allergic reactions as well, and illnesses. Symptoms include pale, cold, clammy skin, rapid weak pulse, increased shallow breathing, dull, glassy-eyed look on the face. There's a whole progression of symptoms, the worst of which to the point where the individual loses consciousness and loses their pulse. The initial first aid involves keeping their airway open, calling for assistance, getting 911 or whatever rescue personnel available to you. Keep the patient lying down. If you can control external bleeding, that would help a lot. Keep the victim warm as well. Heat maintenance is key in first aid for shock. You do the best you can. CPR is always recommended for any healthcare provider. Most institutions require it and require proof of it, which involves a 6 to 8 hour basic life-saving healthcare provider course. CPR courses for the healthcare provider are a little more in-depth than layperson CPR. It includes the use of cardiopulmonary resuscitation, use of an automated external defibrillator, airway obstructions, and there's also some other issues being presented in today's CPR classes, such as use of an EpiPen for severe allergic reactions and Narcan administration for suspected opiate overdoses. Now, you can even see that this slide itself is a little outdated. For CPR for lay rescuers or regular bystanders, don't even use rescue breathing anymore. It's just simple compressions until emergency response arrives. We're not going to hold you to the CPR guidelines, so it's usually 100 to 120 compressions per minute, compressing at a depth of about 2 and 2.5 inches in the adult, 1/2 to 1/3 the diameter of the infant or child, allowing full recoil. This is just something to keep in mind if and when you do take a separate CPR class, which we do offer at Queens as well. Again, I'm not going to hold you to the American Association guidelines for CPR right now. That is a separate course. Plus, these guidelines tend to change every 5 years based on the latest research and development. Okay. In general, if it is one person involved in a rescuer, one person CPR involves a combination of 30 compressions to 2 breaths for adult, child, and infant. If you have 2 rescuers involved, adults are usually still maintained at 30 compressions to 2 breaths, where children, the rate changes from 15 compressions to 1 breath. Rotating compressors and rotating rescuers about every 2 minutes, if possible. So the American Heart Association talks about this chain of survival, in-hospital cardiac arrest versus out-of-hospital cardiac arrest. First is surveillance and prevention, trying to find out who's at risk for going into sudden cardiac arrest, recognition and activation of the emergency response system. Most of the time involves calling 911. If there's an emergency on the school campus, it actually involves calling security before 911. Immediate high quality CPR, cardiopulmonary resuscitation, to get the blood moving, to get the oxygen moving in the system, to keep those brain cells alive until your immediate and your most effective intervention, which is defibrillation, to get that heartbeat going again, is in place, whether it be by bystanders, facility personnel, or by EMS. And then finally, it's also important to talk a little bit about keeping yourself healthy, keeping yourself well in not only your academic, but in your professional career as well. It's funny because most physicians, most medical personnel know very little about nutrition. I myself will admit guilt in that as well. It's not just about what you eat. It requires a holistic approach that just meets physical, emotional, social, spiritual, and economical needs. When I grew up, with the educational teaching was about the 4 food groups, which is kind of gone by the wayside as far as talking about more of a food pyramid involving certain sources of proteins, fruits, vegetables, some fats, plenty of water, and grains as well. Proper nutrition involves a variety of foods from all groups, and an attention to try to stay away from the typical healthcare professional associated diet of fast foods and cafeteria foods, and most importantly, vending machine foods, which can really take its toll over the course of time. And rest and exercise is important as well. The typical adult individual needs about 7 to 9 hours of sleep every single day. It's even harder for those who work the night shift. The human body was not meant to work nights. Human species are not nocturnal species. So if you wind up doing shift work, it's very important to stay in touch with your health hygiene to reduce the side effects of sleep deprivation, like increased blood pressure, increased stress, just to name a few. You can talk about personal hygiene. It's important you're interacting with the public, keeping yourselves clean, not overdoing it on the cosmetics, not overdoing it on the colognes or the perfumes, brushing teeth and mouthwash several times a day, keeping fingernails clean, short, trimmed, also to avoid accidental scratches and trauma, breakthrough in your gloves, proper lifting techniques to protect your back. How much lifting you're going to be doing as a phlebotomist, it can vary. God forbid your patient winds up collapsing or partially collapsing and you need to catch them in midair. You should have a little bit of knowledge of proper lifting and moving mechanics to keep yourself healthy and safe. And don't forget to take time out for yourself dealing with stress management. All medical fields can be very rewarding in and of themselves, but there are stresses that are involved, just like any occupation, that can take its toll. And it's important to find methods to deal with stress so you don't wind up suffering from the adverse outcomes of unmanaged stress, which can weaken the immune system, making you more prone to infectious diseases, which has been shown to increase blood pressure, resulting in long-term hypertension, making people more prone to ulcers, gastric ulcers, migraine headaches, and psychological breakdowns. So, again, beyond the scope of this course, to talk about that, there are courses in your health and phys ed department that deal specifically with nutrition and stress management. I highly recommend looking into maybe taking one or two of these classes on your own. So at the end of this course, what's happened? We've demonstrated the knowledge of infection control and safety. We want to identify policies and procedures for maintaining laboratory safety, demonstrate accepted practices for infection control, isolation techniques, aseptic techniques, and methods for disease prevention, comply with federal, state, and locally mandated regulations regarding safety practice, differentiate between sterile and aseptic techniques, list the causes of stress in the work environment, and discuss some coping skills used to deal with stress in the work environment. And that's it for this week. Please have a wonderful week. We'll see you in class and study hard.